Somewhere in almost every grocery store in this country, there's a small bin near the checkout line, easy to miss if you're not looking for it, sitting between the gum and the tabloid magazines. Twist-wrapped, dark, faintly sweet, the kind of thing a grandchild grabs on the way out and a grandparent buys without a second thought. Because it's not chocolate, it's not a candy bar, it barely even registers as a real indulgence. It feels, if anything, like the responsible thing in that bin. I want to tell you about that specific item tonight, because in nearly 4 decades of medicine, it is one of exactly 2 foods I have personally watched put a patient in a hospital bed with an irregular heartbeat, dangerously low potassium, and blood pressure high enough to genuinely frighten the nurses monitoring it, and the patient in question had done absolutely nothing anyone would call reckless. She'd simply been eating it steadily, a little every day, for about 3 weeks, the way you'd snack on anything you didn't think twice about. Before I tell you what it is, let me rule out what you're already picturing, because I guarantee your mind just went somewhere else entirely. It's not salt. We've covered salt on this channel already, and you already half expect it by now. It's not sugar, and it's not caffeine either, though both of those genuinely matter for blood pressure in their own right. It's not alcohol. This is a specific, single, ordinary food, sold legally, marketed as candy, sitting in that bin by the register in nearly every store in America, and almost nobody watching this has ever once connected it to their blood pressure. I'm Dr. Walter Hale, nearly 4 decades of practicing medicine, and I've chosen to build an entire video around one single ordinary food tonight, rather than a list of 7, because this particular one genuinely deserves the full story rather than 60 seconds squeezed between 6 other things. It's rare, it's specific, and once you understand exactly what it does inside your body, you'll never look at that checkout bin the same way again. Tell me something before we go further, honestly, in the comments. Take one real guess right now before I say it out loud. What do you think it is? I want to see how many people actually get it, and I promise you, the real number of correct guesses tends to be surprisingly, almost embarrassingly small. Here's the mechanism, and I want to walk through it properly, because the why here is genuinely fascinating, not just alarming. The food, quite simply, is black licorice, specifically licorice made with real licorice root extract, not the artificially flavored candy that simply borrows the name, the color, and nothing else. Real licorice root contains a compound called glycyrrhizin, and glycyrrhizin does something remarkable once it's inside your body. It interferes with an enzyme that normally deactivates a hormone called cortisol in your kidneys. When that enzyme gets blocked, cortisol builds up in kidney tissue and starts behaving like a completely different hormone, aldosterone, whose entire job is telling your kidneys to hold on to sodium and water while flushing out potassium. Your body essentially gets tricked into running a hormonal program it never actually turned on, driven by candy, and it keeps running that program for as long as the glycyrrhizin keeps arriving. Doctors actually have a specific, real name for this exact condition, which tells you it's well enough understood and common enough to need one. It's called pseudo-hyperaldosteronism, meaning quite literally a fake version of a genuine hormone disorder caused entirely by food rather than by any actual problem with your hormone-producing glands. Your body isn't malfunctioning. It's being fed a false signal, faithfully, and responding to that false signal exactly the way it's designed to. It's worth understanding why your body has this system at all, because it isn't a design flaw, it's a genuinely useful mechanism being hijacked. Aldosterone exists specifically to help your body hold on to sodium and fluid during real emergencies, significant blood loss, severe dehydration, situations where maintaining blood volume matters more than almost anything else. The enzyme that normally deactivates cortisol before it can trigger that same response is what keeps your body from accidentally running that emergency fluid retention program every single day, just because cortisol, a hormone you produce constantly under everyday stress, happens to be circulating. Glycyrrhizin specifically disables that safeguard. Your body isn't broken, it's running a legitimate emergency protocol at entirely the wrong moment, on a loop, because the substance that's supposed to keep that protocol switched off has been quietly blocked. The people at highest risk here aren't randomly distributed either, and it's worth naming who they are directly. Anyone with existing kidney disease processes glycyrrhizin more slowly, meaning it accumulates faster than in someone with healthy kidneys. Anyone already on a diuretic is already losing potassium through a second pathway simultaneously, compounding the effect rather than simply adding to it. Anyone with an existing heart rhythm condition has far less electrical reserve to absorb a sudden potassium drop safely. And simply being older matters on its own, independent of any diagnosis, because age-related changes in kidney function slow glycyrrhizin clearance even in someone with no formal kidney disease at all. The clinical result of sodium retention plus potassium loss is a combination that should sound familiar from other videos on this channel: rising blood pressure and a heart running on dangerously low potassium, which is precisely the mineral your heart's electrical rhythm depends on most directly. Low enough potassium, for long enough, can trigger genuinely dangerous heart rhythm disturbances, arrhythmias, in a person with no prior heart disease at all, no risk factors, nothing that would have shown up on a routine checkup the month before. This isn't a fringe theory or an internet rumor dressed up as medicine. The FDA has issued a direct public warning about it, stating plainly that eating 2 ounces of black licorice a day for at least 2 weeks could land a person in the hospital with an irregular heart rhythm, and specifically flagging adults over 40 as being at higher risk than younger people, for the simple reason that age itself makes the heart less forgiving of exactly this kind of electrical disruption. This isn't theoretical either. There's a well-documented case published in a major medical journal describing a man who died after a sustained daily habit of eating black licorice, his potassium having dropped low enough to trigger a fatal heart rhythm, discovered only afterward when doctors pieced together his recent habits. Cases like that are genuinely rare, and I don't want to overstate how common a fatal outcome is. But the reason that case made it into a medical journal at all, the reason doctors still discuss it, is precisely because almost nobody sees it coming, including, in that instance, the person it happened to. It's also worth knowing that licorice root shows up in more places than the checkout candy bin, which is exactly why this deserves its own full video rather than a quick mention. Certain herbal teas, particularly ones marketed for digestion or throat soothing, list licorice root as an ingredient. So do a number of herbal supplements marketed under names like adrenal support or DGL, deglycyrrhizinated licorice, though the deglycyrrhizinated versions specifically have had the concerning compound largely removed, which is worth checking for by name if you're using one of these products regularly. Even certain chewing tobaccos and a handful of specialty liqueurs use real licorice flavoring at meaningful concentrations. The common thread across every one of these is the same. Nothing about how they're marketed suggests a connection to blood pressure, so nobody thinks to make it. I want to pause on something important here, because precision matters enormously with this one, more than with almost anything else I've covered on this channel. Most of what's sold as licorice candy in American grocery stores, the red twists, the majority of mass-market brands, contains no real licorice root at all. It's flavored with anise oil, which tastes similar but carries none of the glycyrrhizin risk we're discussing tonight. The genuine article, the one that actually matters here, is specifically black licorice made with real licorice root extract, which is far more common in imported European candy, certain specialty and natural food brands, and various licorice-flavored teas and supplements marketed specifically for digestive health. Read the actual ingredient list specifically every time. If it says licorice root extract or glycyrrhiza glabra, that's the real thing. If the only listed flavor is anise oil, you're looking at something that merely borrowed the name and none of the risk. Let me tell you what this actually looked like for a patient I'll call Marjorie, 69, from a small town outside Providence, Rhode Island. She's a composite, drawn from a number of similar cases rather than one specific person, so there's no privacy concern here, but her story is close enough to several real ones that I think about it often. Marjorie had discovered a specialty imported black licorice at a local shop, genuinely loved it, and had made it her evening ritual, 3 or 4 pieces most nights, replacing the dessert she'd been trying to cut back on. In her mind, she'd made a smart trade, a smaller, simpler treat instead of cake. About 3 weeks in, Marjorie started feeling generally unwell in a way she couldn't quite pin down, tired, a little weak, occasionally lightheaded standing up. She assumed it was simply a rough stretch, maybe not sleeping well, and pushed through it the way a lot of people do rather than calling anyone. It was her daughter, visiting for the weekend and noticing her mother seemed genuinely off, who insisted she get checked that same day rather than waiting. Her blood pressure in the office was significantly elevated. Her potassium was low enough to concern the nurse taking it before I'd even walked in, and an EKG showed the beginnings of exactly the kind of rhythm disturbance that potassium level predicts. When we went through her recent habits together, the licorice came up almost as an aside, something she mentioned the way you'd mention any small pleasure, not remotely suspecting it was relevant. It was, entirely. We stopped the licorice immediately, corrected her potassium, and monitored her closely over the following week. Her numbers returned to normal within days once the source was actually removed, which is, honestly, the most hopeful part of this entire story. Marjorie's case never became a genuine emergency specifically because her daughter pushed for that same-day visit rather than waiting to see if the tiredness passed on its own. What stuck with me afterward wasn't the medicine, it was Marjorie's own reaction when I explained what had actually happened. She sat with it for a moment and then said something I've thought about often since, that she'd spent years being careful about the things that were supposed to be dangerous: dessert, fried food, second helpings, and it had never once occurred to her that the thing she'd chosen specifically because it felt like the safe alternative could be the actual problem. She wasn't angry, she was recalibrating in real time what being careful was even supposed to mean. She still eats licorice occasionally now, real licorice, the kind she genuinely loves, just no longer as a nightly ritual, and she checks her blood pressure at home for a few days afterward whenever she does, treating it, correctly, as something worth a little attention rather than something automatic. I bring up her reaction specifically because I hear a version of it constantly in this line of work. Patients brace themselves for the foods they already feel guilty about. They rarely brace themselves for the ones that feel like a small, sensible substitution, and that gap between what feels dangerous and what actually is turns out to be exactly where a meaningful share of preventable problems live. Here's what makes this particular food more dangerous than most of what ends up on these countdown videos, and I want to be direct about it. Nobody thinks of candy as a medical exposure. Nobody tracks it, mentions it at appointments, or connects it to symptoms the way they might with a new prescription. It sits completely outside the category of things patients think to report, which means it can operate for weeks, sometimes longer, before anyone thinks to ask the one question that would have explained everything. What have you been snacking on lately, and how much of it? Think about how a typical appointment actually goes when someone shows up feeling generally unwell. We ask about medications, always. We ask about recent illness, stress, sleep, sometimes diet in broad strokes, whether you've been eating reasonably well overall. We almost never ask, specifically, is there any one snack or treat you've been having more of than usual lately? Because it sounds like too small a question to matter. Marjorie's case is a direct argument for why it isn't too small at all. The medications on someone's list get reviewed line by line at every visit. The candy dish never makes it onto any list, ever, because nobody thinks a list is where it belongs. This is exactly the blind spot I keep returning to on this channel in different forms, the gap between what genuinely affects your health and what we've collectively agreed counts as medical enough to mention out loud. A prescription pill gets scrutinized, a supplement gets scrutinized, usually. A twist-wrapped candy from a checkout bin gets eaten without a second thought, by design, because that's precisely what candy is supposed to be, effortless and unexamined. Most of the time, that's completely fine. Occasionally, with this one specific compound, it genuinely isn't. I also want to be genuinely fair to licorice here, because the goal tonight isn't to make you afraid of a checkout bin for the rest of your life. An occasional piece, eaten now and then, isn't what caused Marjorie's numbers to climb, and it isn't what the FDA's warning is actually describing. The risk here is specifically tied to steady, sustained daily intake over an extended stretch, the pattern of a habit rather than an occasional treat, which is exactly the pattern that candy, by its nature as something small and repeatable, tends to slip into without anyone noticing the shift from occasional to daily. There's a genuinely strange irony buried in licorice's history that I think about often. For centuries, in traditional medicine, licorice root was actually used to treat people with low blood pressure and adrenal fatigue, prescribed specifically because it raises blood pressure, the exact same mechanism we've spent tonight discussing as a hazard. It wasn't a mistake or a misunderstanding by the people using it that way. In someone whose blood pressure genuinely runs too low, that same effect can be therapeutic rather than dangerous. The compound never changed. What changed is that almost nobody today is eating it under medical supervision for a diagnosed condition. They're eating it from a checkout bin because it tasted good, at a dose and duration nobody calculated for anything, in a body that, for most of us watching this channel, already runs toward the higher end of normal rather than the lower end. If you're on blood pressure medication, if you've ever been told your potassium runs low, or if you're over 40, which describes most people watching this, that's specifically who the FDA's own warning is addressed to, and it's worth taking seriously rather than assuming it applies to someone else. Before we get into what to actually do, I want to leave you with the hopeful half of this story, because it's real and it matters. Unlike a lot of what causes blood pressure trouble, this specific cause resolves fast, genuinely fast, once it's identified. Marjorie's numbers weren't a months-long project to fix. They corrected within days of removing one single item from her routine because there was never anything structurally wrong with her heart, her kidneys, or her blood vessels to begin with. Her body had simply been responding, faithfully and correctly, to a false signal. Remove the false signal, and the correct response follows almost immediately. That's a genuinely rare kind of good news in this field, and I don't want it to get lost underneath everything alarming I've just told you. Here are 4 things genuinely worth actually acting on tonight, not just quietly nodding along to and forgetting by tomorrow. First, if real black licorice, the kind made with genuine licorice root, has become any kind of regular habit for you, more than an occasional piece here and there, that's worth mentioning to your doctor directly, by name, at your next visit, even if absolutely nothing feels wrong yet, since the whole point is catching this before symptoms force the conversation. Second, check the ingredient list on anything labeled licorice in your own cabinet right now, the candy, the tea tins, any digestive or adrenal support supplement you might be taking. If it lists licorice root extract or glycyrrhizin glabra, that's the real thing, worth moderating and worth knowing the daily amount of. If it's anise-flavored only, or specifically labeled deglycyrrhizinated, tonight's warning simply doesn't apply to it, and there's no need to give it up. Third, if you're already on blood pressure medication or a diuretic, treat daily licorice specifically as a direct question for your doctor or pharmacist, the same way we've talked about other risky combinations on this channel before, rather than something to just quietly keep eating without ever mentioning it. Fourth, and this applies far beyond licorice, if you or someone you love develops unexplained fatigue, weakness, or lightheadedness that doesn't have an obvious cause, actually ask out loud what's been eaten regularly over the past few weeks, treating snacks and treats as fair game for that question, not just meals. It's a simple question that gets skipped constantly, precisely because it feels too small to bother asking. And it was the exact question that caught Marjorie's case in time, asked by a daughter who simply refused to accept probably nothing as a full answer. Had you guessed licorice before I said it? Tell me honestly in the comments, and tell me if you or anyone in your family has a habit like Marjorie's sitting quietly in a cabinet somewhere right now, a tin of it in a desk drawer, a bag in the pantry nobody thinks twice about. I read every single comment, and I'd genuinely like to know how many of you had no idea, because in my experience, that number is nearly everyone, including plenty of people who consider themselves careful, informed readers of every label they buy. If tonight was useful, subscribe, because next time I'm walking through what a genuinely common daily medication might be quietly doing to your own muscles, a side effect almost nobody ever connects back to the pill itself. None of this replaces your own doctor. If tonight sounded genuinely familiar, let that be your reason to actually call this week, not to self-diagnose from a video and quietly worry about it alone. I'm Dr. Walter Hale. The candy bin by the register has never once looked medical to a single soul walking past it, and that's exactly why it's worth a second look. Now you know better than that, and so does whoever you decide to send this to.